Hello, my name is Dylan. I am a student of nursing in Javeriana University. So today we will talk about hypertension, a common disease, especially in the elderly. Let us first look at the importance and significance of this disease. So let's start. Hypertension has serious complications in the future if it's not controlled. It's important to consult and be informed. So we must prevent this disease by having healthy habits, but we can all take care of ourselves and have a stable blood pressure from an early age to avoid future complications. But what is the hypertension? In order for all our organs to function, we need to ensure that they get out of the thin blood full of nutrients such as oxygen, protein, and glucose. For this, the body has a specialized system of pipes called arteries and veins, and a specialized pump, which is the heart. This generates a cycle that repeats itself millions of times in our life. So the heart becomes filled with blood between beats, pulling all the blood from the veins and the beats and forcefully expels the blood into the arteries. So this force with which the blood travels through the arteries is called blood pressure. But what is the problem? The problem is when the system is no longer functioning properly. Then it can increase the force with which the blood goes through the arteries. This is called hypertension. This excess of pressure damages the walls of the arteries, causing them to clog or rupture, causing the blood to stop reaching the organs in advanced stage, and in the end, the blood to stop flowing to the arteries, stop functioning. The maximum pressure that represents the force with which the heart pushes the blood into the arteries. This is known as systolic blood pressure. In addition, we have the minimum blood pressure, which is the thrust that the blood has when the heart is not beating. This is known as diastolic blood pressure. So how to control it? The most important thing to control our blood pressure or prevent hypertension from developing is to have a healthy weight, limit alcohol, so drink less than 30 milliliters a day, avoid tobacco completely, eating less than 2.4 of sodium, and practice 30 minutes per day of exercise and continue with the recommendations of the doctor if is necessary. Hypertension is a very common disease that many people develop. So in the clinic, it's important to educate people to control it. It's important to follow the recommendations that we talked about in the presentation to avoid complications in the future. Do two actions that we can do now to prevent that disease. So that is all. I hope this short video will be of help and more people can learn about this disease so common. but so important. See you next time. Goodbye.